surge ever in the state of Indiana. Our beds are at complete capacity, and it's only going to get worse. We will pull through this, but it's going to take a lot of work and a lot of weeks ahead of us.
Some Hoosier health officials say the current COVID-19 surge is the worst we've seen yet. They're warning tonight, and the latest response to this pandemic is our top story live at 5. I'm Dan Spieler.
And I'm Fanchon Stinger. So glad you're with us this evening. State health leaders are reporting almost 1,500 new cases of COVID-19 today as the number of cases goes up. More Hoosiers are also getting tested. That means the positivity rate, well, it is going down. It stands right now at 14%. More than 3,000 COVID-19 patients are being treated at Indiana hospitals. And hospitals say between COVID and non-COVID patients, they have fewer beds available now than any other point at the pandemic.
Yeah, about 5,400 new cases today. Meantime, about 54% of Hoosiers are fully vaccinated against COVID-19. And tonight, Indiana's legislative leaders are debating whether to restrict a business's ability to mandate that vaccine for their employees. This bill would require employers to offer a testing option for unvaccinated workers and have the businesses pay for those tests. Fox 59 State House reporter Kristen Eskow joined a hearing today about that topic. And Kristen, lawmakers are already considering some changes here?
Well, that's right, Dan. The House Majority Leader who wrote the bill says he heard the criticisms raised at the last meeting about the cost of testing to business owners and the absence of penalties for businesses that don't comply with the bill. Now, he floated ideas today for some of those changes, and meanwhile, there are still a lot of concerns about this proposal, especially as Indiana experiences another COVID-19 surge. Another hours-long session of public testimony Thursday at the Indiana State House on the proposal to limit COVID vaccine mandates by private businesses. Dozens of Hoosiers addressed the House Committee on Employment, Labor, and Pensions.
I don't want to not work. I don't want to not be able to feed my children.
Republican lawmakers behind the bill say it's those workers they're trying to protect. The bill would require private employers with COVID vaccine mandates to also offer a testing option and cover the cost of those tests. Medical experts still have concerns, with some returning to the State House to testify a second time.
Vaccine is the single most effective prevention for not getting COVID-19.
Democrats point out concerns from the business community, arguing employers should be allowed to make their own decisions.
I'd like to see employers off the hook for the testing, paying for the testing. Some of these companies have estimates that it'll cost $6 million.
House Majority Leader Matt Lehman, who wrote the bill, says he's looking at ways to address that concern.
We just need to narrow that down into more of the cost of the test. I think there are still some places around the state where you can go and have tests done for free.
Another change he's considering, allowing people denied for medical or religious exemptions to receive unemployment benefits.
Some are saying if you choose not to be vaccinated, that's your voluntary, leaving the employment voluntarily. We're not firing you. Yet I think it's very clear if you don't get the vaccine, we're going to break our ties with you. That's not voluntary.
Now, the doctor I spoke with earlier says he's also concerned about the state ending the public health emergency now amid this latest COVID-19 surge. The author of the bill says he believes it's still time to end the emergency, saying the emergency declaration has more to do with federal funding coming to the state. Kristen Eskow, Fox 59 News.